we know that we are in the depth, in the midst of a mental health crisis like no other. I don't know if there's been another one in history before. And we need help. I think I meet people every single day in practice who, if they're not suffering from some kind of low grade anxiety, it's going on or moving on to depression, moving on to things like eating disorders, moving on to so many different other conditions. And sort of the paradigm I feel of just doing counseling or just doing therapy is kind of not working. And I want to take some time to dive deeper into what's happening out there and what our options and solutions are, because I know as a physician I'm frustrated, I can't imagine what patients are feeling like and what even the rest of the medical community is feeling like. So talk to us a little bit about how you are seeing this evolving mental health crisis, why you think depression is so on the rise.
I think I've shifted the term rather than a mental health crisis, because being a psychiatrist for 30 years, I've been seeing it for 30 years. I've changed the term, which I think is more meaningful right now, to the model of our treatment is in crisis.
Ooh, I
So
like
our
that.
current model, as you suggested, psychotherapy, or if we put the psychiatrist or primary care doctor, medications, it just hasn't been sufficient. So we have such large numbers of patients that haven't been benefited from psychotherapy or medications. And that's the model of care that you and I have been involved in, integrative and functional medicine, that has to get into the treatment plan for treating depression. And that's been what I've devoted my career to.
So having a career that spanned 30 years, you don't really think the incidence is up necessarily of people having anxiety and depression. Am I understanding that correctly? You don't really think that. I feel like it's more and more and more people, but you're saying really the number of people might have been the same. Our model is just failing us.
Well, no, it's absolutely increasing. That's clear to me. But I think when the press uses those terms or researchers uses those terms, all we get is more stats about how it's increasing, and nobody's looking at why. And that's where I think the model of care is just Band-Aids.